Our procedure is called a cesarean section, also known as a C-section. So why would someone need a C-section? Women get them because of complications during pregnancy or because of complications that affect your baby during labor.
Complications during the pregnancy could be if the woman has had a C-section in the past or other surgeries on her uterus, or problems with her placenta that can cause dangerous bleeding during vaginal birth, or if she has an infection like HIV or genital herpes that can spread to her baby during vaginal birth, or if the mom has diabetes or high blood pressure, it could damage certain organs in the woman's body that may put her or the baby in danger, or if the mom is having twins or triplets, it's common for her to have a C-section. Complications that affect the baby during labor could be if the labor does not progress, like if it's too slow or if it stops, if the baby is very large, if the baby's head isn't in a head-down position, and if the baby's feet or bottom is facing down, it's called breech, and if the baby's shoulders are facing down, then it's called transverse position, or if the umbilical cord is pinched or the woman has umbilical cord prolapse, which is when the umbilical cord slips into the vagina before the baby, or the umbilical cord is wrapped around the baby's head, or if the baby is in distress, which means their heartbeat is not regular, or they aren't getting enough oxygen, or if the baby has severe birth defects. If you needed a C-section because vaginal birth put you or your baby in danger, not having it could risk the loss of the baby's life or of the woman's life. Older women are more likely to have C-sections than younger moms, and C-sections are most popular in countries that are technologically advanced because most people in poor countries do not have access to these procedures. And C-sections are used to fix a problem, not to cure a disease.
Okay, so the procedure is performed at a hospital, and it's performed by an obstetrician who are doctors that care for pregnant women. The equipment that is needed is listed here, and some of the important ones are forceps, curved scissors, straight scissors, and a lot more. The preparations that are needed by the patient is that the night before your C-section, you are not allowed to eat, drink, or smoke after midnight. Also, you should check with your doctor before taking any medication and pack a hospital bag and get everything prepared at home. Some of the risks of the procedure is that you could lose the baby, get an infection, have postpartum hemorrhage, the reaction to anesthesia, blood clots, wound infection, surgical injury, increased risk in future pregnancy, and possible death. The outcome of this procedure is that if it's successful, you will have a baby.
This next section is about personal accounts, and I interviewed Betsy Perkinson to find more information about this procedure. She has had 2 C-sections. Her first was done because she was dilated, but her baby wouldn't drop because it was too big. So if nothing happened within 2 days, she had to have a C-section. She had a C-section 2 days later, and it turned out it saved her baby's life because the umbilical cord was wrapped around his neck 3 times. The second C-section was done because if you previously had a C-section, a natural childbirth would cause a uterine rupture. So some questions I asked her was, how does it feel to get this done? Does it hurt? Etc. When you have it done, you don't feel anything because you're numb, but recovery hurts. Then I asked, what can be done to make a procedure easier on a person? She said, if a person knows they will have a C-section, they should exercise and prepare because the recovery isn't as hard. Is this a procedure that will improve a person's life? Is it something you would encourage a person to do as a preventative medicine? C-sections are sometimes planned and sometimes are done if a woman starts labor and has problems. They are beneficial because they are needed to protect the health of your baby. I would recommend it if your baby needs it to survive or if you have had a previously done C-section. How would you convince your friend/sibling to get this procedure done? If they ask me personally, I would say to get a C-section
but I've never experienced labor, so they should do what is best for themselves and their baby. And this is our Works Cited. Thanks for watching.
Dad.